Hi everyone, and welcome to the Warwick Institute of Engagement Student Showcase. My name is Professor Michael Scott, and I'm one of the co-directors of the Warwick Institute. Hi everyone, and welcome to the Warwick Institute of Engagement Student Showcase. My name is Professor Michael Scott, and I'm one of the co-directors of the Warwick Institute of Engagement. And along with Professor Kate Asprey, Naomi Kay, and James Brown, we've been teaching this past term our first ever taught module in conjunction with IATL, the Institute for Advanced Teaching and Learning at Warwick. And our students tonight are going to be completing their final piece of assessed coursework for that module by delivering to you group presentations on issues close to their heart that they want to share with the public. So this is an incredibly exciting moment, but it's also a really important moment in the history of the Institute of Engagement. Not only is this the culmination of our first taught module, but it's also the week in which we announce our new collection of honorary fellows, foundation fellows, and associate fellows who are going to be working with the Institute team in the months and years to come. And we're very, very delighted that some of those fellows are able to join us this evening in the audience to listen to the next generation of engagers, our students, show us how it's done. So without further ado, I hand you over to the students, the class of 2020-2021, and what a year it has been, delivering to you their thoughts on topics that we all need to engage with.
Hello, everyone, and welcome to our public engagement event on the COVID-19 vaccine. I'm Celine, and I'm a final year liberal arts student, and our group are made up of undergraduate students from a wide range of interdisciplinary backgrounds. So we've aimed to make our event engaging to everyone, regardless of your level of expertise on the topic. For example, I'm sure just a year ago, many of us would have never heard of the word epidemiology, let alone guessed it would become a constant kind of everyday part of the public discourse that we have. So we're trying to engage with things like that. As I'm sure you're all aware, this is a very current topic with advancements happening all the time. So we've endeavored to keep the information we're providing you with as in line with new developments as possible. Also, as a disclaimer, there'll be some discussion of serious mental illness within the context of our research and how the news of the vaccine has affected different kinds of stakeholders. As this is a live stream, I'm going to ask that you please bear with us for any potential technical problems, as can often happen with such events. And we'll have time at the end of the event to share any thoughts that you've had on the topic, and hopefully we'll also be able to share some of our slides and information. So we'll have links to studies or sources that we've mentioned. And as this is interactive, we're also going to ask you to share some of that with us via Slido at the end of the presentation. So please be prepared to access that on another tab if possible. So, COVID-19 has had both positive and negative effects on us all. For some, the lockdown actually provided more free time to work on personal projects or allowed them to spend more time with loved ones, while for others, COVID-19 led to a loss of their loved ones and jobs. In an effort to control the spread of the virus, COVID-19 vaccines were created. Although this development seems like the answer many are hoping and praying for, a lot of people actually have doubts and questions about the vaccine, and rightfully so. So at the top of the screen there in figure 1, this is a screenshot of the top 3 search trends related to vaccines in the UK. And as you can see, everyone wants to know more about the disease, the vaccine, and what it contains. So these are all the top Google trends from 2020. So 1, 2, 3, there you can see what everyone was searching. So what I'm going to ask you to do is comment in the chat section what you basically did to find information on the COVID-19 vaccine, so how you access that information, and if you have any comments on that, if you could just quickly put that in the chat, that would be great. The screen does say Slido, but again, with live events, technical things change, so if you could just pop that into the YouTube chat, that would be great. So that's how you've accessed information on the COVID-19 vaccine. Oh, great, thank you. Seeing many messages coming in. We've got Shan Jones, who said who and Google. James Brown, mostly news articles. Lady George, Instagram news pages, Andrew Fletcher, Twitter. Okay, so you've got a wide range of different things in the chat there. Have a look yourself. You can see there's many different ones. So as you can see, information on the vaccine can be gotten from a wide range of different things or different places. So while this is great, your searches could lead to either sources of information, but then also misinformation on the other hand. And some people aren't searching for information via verified scientific sources, but rather relying purely on social media and other platforms for information related to the vaccine. The spread of misinformation about the COVID-19 vaccine is a problem because it creates doubts in people's mind, which then translates to mass vaccine refusal and hesitancy. If a substantial percentage of the UK population aren't vaccinated, the spread of the virus won't be controlled. So the aim of this presentation is to educate us all on the COVID-19 vaccine. So, what is COVID-19 and how is it transmitted? Just to give some background information on COVID-19 before going into details about the vaccine. So COVID-19 is an infectious disease caused by the SARS-CoV-2 virus and can be transmitted through respiratory and contact routes. With COVID-19 being an infectious disease, the best and proven way to control its spread is through the use of vaccines. For example, smallpox was declared eradicated by the World Health Organization, WHO, which someone mentioned, so well done, in 1980, and the WHO also stated that this eradication was solely through vaccination. This accomplished feat shows that vaccines do work, hence the creation and distribution of the COVID-19 vaccine. So vaccines contain either weakened or destroyed versions of bacteria or virus, and in some cases it's protein or toxin, but in the case of the COVID-19 vaccine, it contains mRNA. Currently, there are two vaccines that are cleared for use in the UK, which are the Pfizer-BioNTech vaccine and the Oxford-Astrazenca vaccine. The speed at which these vaccines were cleared for use has made people a bit doubtful of their quality and safety. However, I'll talk you through the timeline of the vaccine development process and why its speed shouldn't be a cause for concern. So on the screen, you can see the timeline of the process there, and the figure shows the timeline of the process. And for example, preclinical studies, which involved testing the vaccine on animals, took place between January and March 2020. And then the phase 1 to 2 of clinical trials, which involves around 15 to 30 people, took place between April and June 2020. This was then followed by phase 2 to 3 clinical trials, which involve around 100 people. Now, an interesting and important part of this figure is the kind of overlap, which can be seen between the time the clinical trials took place and the volume of submissions to regulators. So regulators refer to the bodies that ensure the efficacy and safety of vaccines in the UK. And the body responsible for this is the Medicines and Healthcare Regulatory Authority, or the MHRA. Back to the overlap, what it basically means is that the rate at which the vaccine was approved was faster because the MHRA was reviewing data alongside the trials. So other reasons why this process was a lot faster include there was a large amount of funding being pumped into the research project, as we all know. The vaccine, as I mentioned before, is mRNA based, which means the vaccine contains genetic information that does not code for the virus, but rather codes for a component of the virus. And also there's no negative side effects that were seen during the clinical trials. So it made it a lot easier to clear out the vaccine for mass distribution. So why should you trust the vaccines? Firstly, because of what the COVID-19 vaccine aims to accomplish, and that's to control the spread of COVID-19 by providing immunity. So this does not mean that after receiving the vaccine, you can't get infected by the virus, but rather if you do get infected, the symptoms won't be as severe because your body has already kind of produced the antibodies to fight against the virus, and also to protect the vulnerable people in society that can't get the vaccine, such as people that are ill, pregnant women, and people with allergies. And secondly, while the vaccine is being rolled out, it's also closely being monitored by the MHRA, which, as I mentioned, is the regulatory body in the UK. So if there are any side effects or if the vaccine isn't as effective, it will be pulled from distribution. So the aim of the vaccine only works if a good percentage of the nation and the world gets vaccinated. So the next segment of this presentation will delve into the socioeconomic effects of the COVID-19 vaccine. Thank you for listening.
Hello, everybody. Thank you, Celine. I'm Sam. I'm going to be talking about the socioeconomic effects of the COVID vaccine, in which what it's currently having and what it will have on the populace. Firstly, let's talk about the UK's privileges towards the vaccine. Most notably, the UK founded AstraZeneca, that vaccine, which is the most pre-ordered of existing vaccines, but also is already in the UK for us to gather. The image on screen is evidence from a Nature news article by Asha Mullard. As you can see, the UK's vaccine has been pre-ordered by many and also has potential expansions on these deals. In the blue, we have estimated 3 billion doses distributed in 2021. Asha mentions that the UK is selling the vaccine for $3 to $4 to the US, which, if 3 billion estimate is correct, will give the UK £6.63 billion sterling. It is not clear whether the cost to make and distribute the vaccine is in this account. However, Mullard expands on the fact that AstraZeneca has pledged to provide the vaccine on a not-for-profit basis for the duration of the pandemic. Therefore, it can be assumed the UK is not profiting off of the vaccine. However, there does not seem to be full transparency in this regard. Additionally, Mullard mentions that the price that the UK is offering for the vaccine is between 5 and 10 times cheaper than the estimated prices of other leading candidates, such as the one made in New York City, Pfizer, and the Cambridge, Massachusetts one. Asha Mullard goes into some detail about the privileges of the developed nations versus those in less privileged situations. In this article, they highlight that many low-income countries might have to wait until 2023 or 2024 for the vaccination. Indeed, Asha Mullard puts out that the 27 members of the European Union and 5 other countries have already pre-ordered about half of the vaccines, and that these countries only account for 13% of the global population. This buying out of many vaccine causes problem for many low-income and low and middle-income countries. Thus, the creation of COVAX has been founded by Gavi and the World Health Organization, and many other countries have joined in on this. However, some of the high-income countries that have joined in on COVAX have said that they will donate some of the spare vaccines, but it doesn't help for equitable distribution because obviously they're going to validate their own countries before they pass on excess. I think it's important to highlight who is getting the vaccine and the privileges we hold as a nation to get it before other countries that are not in as much fortunate situation. Therefore, this graph shows how the UK is distributing. This graph shows how the UK is distributing vaccination. Another social aspect of the COVID vaccine is who is getting it first. In the UK, it has been identified that those most vulnerable will be giving it first. These include the older generation, health and care social workers, and then those who are extremely vulnerable from 16 to 64. In the chart presented by the Health Foundation, it points out who is getting vaccinated and what percentage of the population they are. As explained by Celine, vaccinations do not stop people from getting the virus. It simply decreases the percentage of those infected being hospitalized. After discussing the UK and how we are distributing the vaccine, I think it is important to get a world view. Therefore, I point to Peter Beaumont's article which is COVID-19, who are countries prioritizing first? The World Health Organization has already put out a statement that they recommend giving it to those at high risk for corona. Germany and Italy and Spain have followed similar guidelines to us in distributing it to the elderly, high risks, and health and social care workers. However, Germany and Italy differ in the fact that Germany is also targeting public and emergency service workers in the second section, while Italy are targeting military and police forces. France's approach is different to what the World Health Organization has suggested. They are not only targeting those at high risk, but also chauffeurs, taxi drivers, retail workers, school staff, abattoirs, which is also house workers, and those working in construction. In another article by Eileen Gao and Charlotte G, they cover the US and China's way of dealing with the COVID vaccine. The US is giving the vaccine to healthcare workers first, followed by essential workers such as school workers and those with health issues or who are older than 65. China has given it to their Liberation Army members and essential workers. In a quotation, little is known about how Chinese government is prioritizing vaccine distribution domestically, though local reports suggest that individual provinces are making their own plans to buy vaccine doses, which will cost 200 RMB per dose, which is roughly $30. Although I've not mentioned all countries, I just wanted to give an insight in how other countries are dealing with this pandemic, socially and economically. One thing I would like to point out, which is covered in another article by Holly Krell, is that other nations like the US are currently drafting plans to prioritize vaccinating essential workers such as teachers, shop staff, emergency services. However, the UK has not yet confirmed whether they're doing this. Krell poses this as a moral dilemma, as these groups are much more likely to be exposed to the virus, but obviously are not as high risk as those in their late 70s. However, she thinks that people in their 70s are more likely to be able to shield until the vaccine is more widely available. That concludes my point about the worldview of the vaccine and how different nations are dealing with it socially and economically. In the creation of the vaccine, there has been a rising in hesitancy by the public. Lucy will go into further detail on this with personal accounts, but I would like to touch on some primary research against the vaccine. Firstly, with any vaccine, there comes hesitancy, with some parents already being anti-vaxxers and conspiracy theories running wild. In the modern day, it's easy to fall into fake news, with social media being at everyone's fingertips. We all know how quickly something wrong can be spread. An example that comes to mind is Donald Trump saying if people inject themselves with disinfectant, they can cure themselves of coronavirus. I would advise everyone, before believing anything you see on socials, do your own research into it. I will now hand over to Lucy. Thank you.
Hi there, I'm Lucy, and I'm going to be talking to you a bit about how we engage the public and our peers to gauge their views on the vaccine and the impact that the pandemic has had on them. So over 3 of our Instagram accounts, we put out a poll to try and gauge the impact of COVID and the feelings around the vaccine for our age demographic. We asked 6 questions, as you can see on the screen now. So one of the ones that we picked out as being particularly interesting, especially following on from what Sam just said, was the point about whether people trusted the government with regards to COVID and the vaccination process. So you can see this is a very kind of split, with 53% saying yes and 47% saying no. So I think this just really further reinforces the hesitancy that surrounds the vaccine and the government, and whether people trust what goes on behind closed doors. However, it is reassuring when we look at the point about whether people will definitely be taking the COVID vaccine, that 85% of young people will still take the vaccine when it is made available to them. So this is very reassuring to see. We then spoke to a student mental health nurse about her experience of working during the pandemic and how the vaccine will affect her going on kind of in her further studies. So in terms of how she felt about the prospect of the COVID vaccine, and how, and if any of her views had kind of been affected by any of her peers, she thinks that personally a COVID-19 vaccine will be great in tackling the spread of the virus and protecting the NHS more crucially. But many of her peers, even her nursing colleagues, have been quite apprehensive about the idea, because they kind of worry that they don't know the long-term effects of the vaccine. And she said she does understand kind of their concern, but she thinks that right now the vaccine is the best thing to protect us from the virus and people who are exposed to it. But I think it is quite easy to understand, hearing that, the fact that even some young nurses, seeing the older nurses that they look up to, are not sure about the vaccine, you can see why they would then be a bit sort of unsure about taking it themselves. So obviously working in the height of a pandemic as a nurse is kind of not anything that you would expect, especially during your student years. So I kind of asked her how her experience had been, and she said that because she's working as a student mental health nurse specifically on a community-based placement, she's had to visit vulnerable patients in their own homes multiple times a day. And a lot of the patients haven't quite fully realised the seriousness of the kind of the pandemic, and don't want to wear a mask, don't want to wash their hands, and continuing to mix with people as normal. It's been frightening for her, and she's had to be in kind of full PPE and stay really careful. But it hasn't had a negative effect on her experience. It's just one that she's had to overcome, because she never expected to have when she initially went into the training. I think, and then we asked her then about kind of the impact of what the vaccine will have, the kind of effect it will have on her studies and her placements. So that because she's been feeling so extremely anxious within a hospital setting, the vaccine can only really kind of decrease that vulnerability. And she just wants it to allow a safer workplace and a safer environment for everyone to be in. Because even though she's kind of been in PPE, she worries that she'll take something into those vulnerable patients in there. So just the vaccine will make the whole kind of study experience and life as a student nurse hopefully a lot more relaxed. And it was quite interesting speaking to her about kind of if many of her patients were anti-mask wearing or anti-vaccine, and how did she feel sort of working around them. And actually a lot of her patients are anti-mask and anti-vaccine because they are mentally unwell. And they don't really, like I said before, don't really fully understand the pandemic, and sometimes don't even know what COVID-19. And they're kind of living in fear about this kind of issue that the government is going to inject them with something with a vaccine, and it's all a hoax and it won't harm them. And I think it really just highlights to us how much fake news is out there. The fact that people are thinking this and still believing things that maybe they read on social media, on Facebook, Twitter, whatever it may be. So it's just really important to point people in the correct direction of kind of valid COVID sources and the importance of them being valid. So we just finally asked her how she kind of felt about, is she researched into the vaccine, or was she more just happy that it finally kind of come out and be ready for use? And she said that because she thinks it is the most effective way of controlling COVID-19, she's going to feel a lot more safe and less anxious from exposure to the virus. And she would expect to receive the vaccine on March of this year, which is really reassuring. And I think hearing firsthand from a nurse the experiences that she's had makes you realise how important the rollout of this vaccine really is, in order for people most of all just to go back and do their jobs that they love safely while kind of protecting themselves and those they look after. So just off the back of our Instagram poll, we had a few people come to us who were lucky enough to come forward, and they said, you know, we've already had the vaccine and we'd like to share our experiences with you. So an occupational therapist spoke to us and kind of said that she was a bit apprehensive about it, didn't know what the side effects were going to be, but she said it was honestly more than okay. It was a bit more painful than the flu jab, purely because it just goes into a different place. She had a dead arm for about 48 hours and was a bit kind of headachy and a bit tired, but nothing that paracetamol couldn't help, and no other major side effects, and that really stopped her from doing anything out of the ordinary. Following on from this, a healthcare assistant came forward and said that she basically felt the same, a little bit of a sore arm, a little bit of fatigue, but nothing really. She got the vaccine on the Saturday, and we spoke to her on Monday, and by that point she said she felt totally fine. So for us, I think it's really important to spread positive vaccine experiences, as well as the all too often negative experiences that we hear in the news and in the media. With this being such a pessimistic time for everyone around us, and most of us, I think, are feeling a bit down about it at the moment, it's so vital to see these glimmers of hope and positivity, and just to prove to people that there is light at the end of the tunnel and that the vaccine is going to work. Thank you.
Oh, thank you guys for such an amazing presentation on the COVID-19 vaccine. So I definitely learned a lot. So now we'd like to kindly ask that you use the code down below, the Slido code. It will lead you to an open text poll where you can let us know what you learned from this presentation. Also, please direct your questions to Slido as well. Basically, after filling in the open text poll, there's a Q&A button, as you can see on the screen at the top, where you can let us know what you think about the vaccine. We would like to have like a conversation with you guys. Thank you.
Yeah, we see there's quite a lot of things in the comments already that people have mentioned. I know quite a few people mentioned about the kind of distribution preferences between different countries, and even in the UK, I know some news that I was watching, and people mentioned how there's kind of a discrepancy perhaps in wealth, with those with more money being able to go to private sources to gain the vaccine. So again, there's so many different developments happening with the vaccine and its distribution. So yeah, this is obviously a very fast developing subject, and we'll try and answer the questions to the best of our ability.
Yeah.
I thought I would answer Phil Gemmett's question. It says, I heard a difference between misinformation, accidental, misinformed, and disinformation, intentional, malicious. Do you think having those terms in public use would help with these conversations? I think that would definitely help, considering so during my research, I actually found people were creating fake accounts for doctors on Twitter, which interestingly, trying to figure out whether that fits into misinformation or disinformation. Because are they being malicious in their intent? What are they trying to gain from these things? I think your question makes me ask more questions. But that's a very good question. Thank you.
Yeah, someone really liked to see like that they sort of got insight from frontline nurses, and I think it's very interesting that we're able to do that as well, because I think nurses have sort of been at the front line, as you said, throughout all of this. So it made sense that we included them in our presentation.
Has anyone got any further questions about the social economic impact, or whether you want answers from Lucy for like personal accounts of the vaccinations, or anything to do with the scientific version? You can either go for Joy or Celine. Feel free to put them in the comments or in the Slido. I feel like it would be better if you put it in the Slido, please, if that's possible.
I'll just pick up on Kevin's comment here. I think it is, in a way, I think nurses probably do need more reassurance from scientists, because I know I've seen recently on the news about PPE being kind of well, obviously when you're working on the COVID ward, it's really sort of high standard PPE, but then just general nurses on the wards aren't getting PPE to the same kind of standard. And I think it's important for them to have that reassurance. They need that reassurance to come from the scientists that their PPE is kind of up to the right standard, because otherwise you don't want to go into an unsafe workplace and feel kind of unsafe. I think, like the nurse that we spoke to has, she's just always felt anxious being in hospital, which is obviously awful when they're trying to do a job that they love. So I think for scientists to kind of come forward, a bit more reassurance for nurses, it would be really, really quite helpful.
Yeah, actually, Lucy, just kind of jumping on the back there, that reminds me, from a kind of science studies perspective, there was something which I believe it was Gordon Graham, who's an expert on public issues, said, and he kind of spoke about how it's very difficult for scientists to try and convey their research to the public, and especially politicians, in a way that isn't relativistic. So when politicians have an agenda of trying to create a policy, it's difficult for scientists to kind of put their academic research into that kind of same way of functioning. So it is quite an interesting one, especially when the levels of scientific literacy are very different between, as you mentioned, with like nurses who need reassurance from scientists, but the scientists conduct the research, and then the frontline workers who they have a completely different agenda because they are trying to save lives. So it's fascinating trying to balance those things between each other, definitely. Oh, yeah, I think we've got Evan Smith's question there. Do you think the vaccine will become a political issue, just as masks have? I mean, who can say at this point? I mean, obviously, as I mentioned, the political agendas, but I think the nation, the world in general, everyone does want to hopefully be able to move forward from lockdowns and move forward from the pandemic in a way which everyone can benefit. So
can I add to that? Oh,
yeah,
sorry, I was going to add to that question. I started speaking and realized my mic was muted. I think it's almost already becoming a political issue. After social political issue, because after some of my research, I think it's interesting to look at things in perspective of a worldview and who is getting it first, in terms of like who can actually afford it first as well. especially, for example, if in the UK it becomes more readily available through privatisation instead of through the NHS, I think that would cause a large amount of political issues. That's all I'd like to add to that.
Yeah. So there's a question here about, it's on the screen, about new virus mutations arising. So the thing with vaccines is vaccines are the best way to sort of prevent mutations from occurring at a very fast rate, a rapid rate. So I would say there isn't like a greater chance, but sort of a lower chance of mutations arising. And also, if you're trying to get more information on this, Gov UK and the NHS are like one of the best places to get your information from as well. And it's 6:30.
It is.
We've got time for.
Yeah.
I think that's all we've got time for.
Yeah.
But thank you, everybody. Hopefully, I don't know how we can answer the questions that everyone's got, but hopefully we've given you some sources to go look it up for yourself. Which would be good. Thank you, everyone, for coming. It's been great. I hope you enjoyed.
The second
Thank you.
live stream after this as well. Thank you. Bye.
Bye, everyone.